If you have a fistula or a graft for hemodialysis, you know that problems are going to happen, right? If you never have a problem with your access, great for you. You're very lucky, because most of the time they develop problems over time. The good news is we can fix these problems almost always in a minimally invasive fashion. Bleeding will happen when you have a narrowing in the outflow of the graft, which is, here is the fistula, so the blood flow is coming here, and when it gets here, it has a hard time going, so it will tend to bleed out in the needle holes. Also, during the dialysis, the nurse may tell you, oh my God, we're getting some elevated pressures there. And that's what that means, that you have a narrowing in the vein or in the graft in the outflow portion, which is beyond the area that they are accessing. And if that's happening, what you need is a fistulogram, which means we put a needle sometimes into the groin, sometimes directly into the access, and we inject dye to see what's going on. And if we find the narrowing, we can treat either with a special balloon called an angioplasty balloon, or a small cage, a metallic cage or a fabric cover cage that will keep it open, called a stent. Another problem that we see is that during dialysis, you may have low flows, flows that are not enough for a good dialysis. And that can manifest in two ways. One is the nurse telling you, the machine's telling me that the flows are low. That's the most common way, actually. The second way is you're getting dialysis 3 times a week, but you're still not feeling well, which means that the dialysis is not working that well. And that can be a problem. Here's where the vein or the graft are attaching to the artery. And the blockage is actually before the area that they are putting the needles on. So because the flow is having a hard time going through this, causes low flow during dialysis. And how do we treat this? Well, the same way. We usually tend to go to the groin and advance a catheter all the way to your arm. And once you get through the blockage, we can treat with a balloon or a stent, like I mentioned before. Sometimes we use a fancy medicated balloon that can make it stay open longer, and we're very successful in fixing these things. Another problem that can happen over time is patients can develop severe arm swelling. Usually what's happening is the fistula or the graft is working okay. But then when you're getting to this, what we call central veins, which are the veins that are taking the blood flow directly to the heart, get narrowed. And these are called the brachiocephalic vein and the superior vena cava, and you can have blockages on those veins. And essentially the treatment is the same. We usually go in through the groin, and we're able to find where the blockage is, and we usually treat with a placement of a stent. These stents are larger because these veins are large. They are between 1 to 2 centimeters in size. And last but not least, we have clotting, and that's when the whole access clots. So you go to dialysis and they can't even access because the whole access is clotted. So what do we do? Well, sometimes we inject a clot-buster in the access to dissolve that clot, or sometimes we use some fancy devices that we can introduce either to the groin or through the arm to actually remove the clot. We can essentially aspirate it so we can reestablish flow into the graft. Now, clotting usually happens as a result of a narrowing somewhere in the graft, especially if you were having the other problems before and nothing was done about it, you can develop clotting. So we have to fix these problems after we remove the clot. And 99% of the time we're able to do it, but if we don't, we may need to put a dialysis catheter, at least temporarily until you have a new access. I hope this will help you to take a better care of your dialysis access. This is Minimally Invasive Insights, and thanks for watching.